The final cranial nerve is the 12th, or hypoglossal, which is the muscles to the tongue. Open your mouth. Just try and let your tongue relax. And Enrique actually relaxes her tongue very well. In fact, people tend to overcall fasciculations, which are little worm-like movements of the tongue. In most patients, it's difficult to relax the tongue in the floor of the mouth, and especially if you don't ask them to relax it that way, but say stick out your tongue. No, just straight out, and relax it. Try and hold it there. If we look now, in fact, there are little movements which may be miscalled as fasciculation. So the tongue is a difficult muscle to relax. If there's no atrophy, chances are there are no fasciculations. All right, stick out your tongue. A little bit more. Okay. And the tongue should not protrude to one side or the other. We can test its strength by pushing against the cheek. Put it in. Push against the cheek and the other side. Good. The other way you can do this is stick your tongue out a bit, a little bit more, push it against the tongue depressor, and the other way. That's just another way instead of pushing into the cheek. Some feel it's more reliable because you can actually see the tongue as it's performing those actions. If the tongue is weak, it tends to protrude to the side of weakness. If you had a patient who had facial weakness, and so they had a droopy face, it would be important to support the face as they protrude their tongue, because otherwise you may be fooled into thinking there's tongue weakness when it's in fact the facial weakness that makes the tongue appear if it's weak.